Ministry of Health of Ukraine. Krok 2. Medicine. Year 2019, number 131. 3 hours after a trauma, a young man developed bradycardia of 46 per minute, anisocoria D greater than S. Hemi-hyperreflexia S greater than D, hemihypesthesia on the left, and a convulsive disorder. The character of this process needs to be clarified. What method of examination will be the most accurate for this purpose? A. Lumbar puncture. B. Brain court. C. Electroencephalography. D. Echoencephalography. E. Skull X-ray. Anisocoria is a condition characterized by unequal pupil sizes. It is relatively common, and causes vary from benign physiologic anisocoria to potentially life-threatening emergencies. It is caused by impaired dilation, sympathetic pathway, or impaired constriction, parasympathetic pathway, of pupils. Hyperreflexia is overactive or overresponsive bodily reflexes. Examples of this include twitching and spastic tendencies. It indicates an upper motor neuron lesion, and reflects a loss of inhibitory modulation of the motor pathways, disinhibition. It is often associated with increased muscle tone. Spasticity. Hemi-hyperreflexia means that half of the body has the condition of hyperreflexia. Hypesthesia is a diminished capacity for physical sensation, especially of the skin. Hemihypesthesia is a reduction in sensitivity on one side of the body. It can occur from damage to the thalamocortical fibers in the posterior limb of the internal capsule, the part behind the genu of the internal capsule, between the thalamus and lenticular nucleus. Convulsion causes muscles to involuntarily contract and spasm, resulting in sudden, violent, and irregular movements of the body. It is because the nerve cell activity in the brain is disrupted. It may be associated with epilepsy, a head injury, severe fever, an inflammatory brain infection, exposure to toxins, and certain medications. Brain court scan is a non-invasive diagnostic imaging procedure that uses special X-rays measurements to produce horizontal, or axial, images, often called slices, of the brain. Skull X-rays may be done to diagnose fractures of the bones of the skull, birth defects, infection, foreign bodies, pituitary tumors, and certain metabolic and endocrine disorders that cause bone defects of the skull. Electroencephalography is a method to record an electrogram of the electrical activity on the scalp. Electroencephalogram is a recording of brain activity. The electrodes are attached to the scalp to pick up the electrical signals produced by the brain. These signals are recorded by a machine for diagnosis. Echoencephalography is the detailing of interfaces in the brain for detecting abnormalities within the cranial cavity, based on the reflection of ultrasonic waves delivered to the head through a probe held firmly to the scalp. The answer is B. Brain court.